Sick sinus syndrome consists of a bunch of different abnormalities which is identified as failure of propagation of depolarization beyond sinus node, also known as sinus exit block, or failure to generate impulse within SA node. Today's case is about exit blocks, and you can see the different types in this slide. On the top, you can see some black lines in the beginning of the P waves. We call it sinus impulse. As you notice, there is no space between sinus impulses and P waves in a normal ECG. But these intervals are increased when there is a first degree SA block. Of course, sinus impulses are not seen in surface ECG, so first degree SA block cannot be identified by a surface ECG. When we have second degree SA block, it can be Mobitz type 1, also known as Wenckebach, or Mobitz type 2. In Wenckebach, the interval between sinus impulses and P waves are gradually increased till a P wave fails to generate. Of course, sinus impulses are present even when there is no P wave, but we only see a skipped bit. Type 2 SA block can be shown as 2 to 1 SA block. About this rhythm strip, because there is no space between sinus impulses and P waves, it is most probably a Mobitz type 2 type 2 to 1 SA block. In third degree SA block, also known as complete SA block, there is no propagation of sinus impulses into atria, and so there is no P waves. These QRS waves are generated by an ectopic rhythms called junctional escape rhythms. Now we have three rhythm strips which are obtained by same patients but at different times. On the top you see a regular sinus rhythm until there is a space between two QRSs which is 2 times longer than previous cycle lengths. We can indirectly find out that maybe there is a failed propagation of sinus impulse to the atria, and so it is a Mobitz type 2 sinus exit block. On the middle, you see a group beating with regular skipped P waves. Here we can mark probable sinus impulses which is consistent with Wenckebach SA block. There is a gradual increase in interval between sinus impulses and P waves until there is a skipped P waves, so there is called Wenckebach SA block. On the bottom, you see 3 beats which are sinus in rhythm, and after that there is no P waves, and the junctional escape rhythm is seen. Sinus arrest or third degree SA block are possible diagnoses.